Welcome back, listeners, to Mosaic's Community Life podcast, Life in Canada, Episode 7. My name is Jane Teasdale, one of the co-owners of Mosaic Home Care Services and Community Resource Centres. We have a very special guest joining us today, speaking all the way from BC, Canada, Kahir Lalji, Provincial Director, Government Relations and Program Population Health United Way, British Columbia. I first met Kahir at the Global Cafe, where he was discussing about social prescribing. And finally, Kahir, welcome. My introduction didn't do you justice, really, on all the community work you are doing in the communities in BC's interior, Lower Mainland, and Central and Northern Vancouver Island. I was just wondering, Kahir, if you could explain to the listeners and those viewing the podcast, what is your work that you do within British Columbia and through the United Way?
First of all, thank you, Jane, for having me. It's an honor to be a part of this podcast, and I want to recognize you and your group for your thought leadership on such important work around person-centered approaches to support and care. As part of United Way British Columbia, we believe that enhancing vital connections amongst people are so important to one's quality of life. United Way British Columbia works in communities across British Columbia, offering supports to those members of our communities that need a little bit more support during our time. And this includes things like providing access to food, providing support for children and youth, providing support for mental health, as well as providing community-based programs to support older British Columbians, their families, their friends, and their caregivers.
No, amazing work. And I've seen, some of the postings that you've done on Facebook as well. And I know, when we had met again, actually, at the International Federation on Aging Conference, Healthy Aging, and this was held in Niagara Falls in October before the Omicron hit. We were lucky to be able to have that conference. And I know we had many discussions on person-centered care, the work that you're doing within BC, definitely social prescribing, community, social engagement, and also community mapping. And I just wanted, Kahir, for you to explain to the viewers and also listeners of really what is social prescribing.
Yeah, thanks, Jane. So, I would first of all say, if the last couple of years have taught us anything, one thing I would say is that it's really heightened and elevated the conversation around the need to engage with your environment, to engage with your community, and the importance of social connection and the detriment loneliness can have on one's quality of life has really been profiled and seen over the last couple of years, specifically. Not to say that these issues didn't happen prior or will continue to happen post, but it's definitely been heightened during the pandemic.
Yes, definitely.
Yeah. And, it's been so interesting because all of the work that we do in supporting older British Columbians and Canadians in this context comes from the recommendations from community. We go out and we speak to community to inform us what are some of the gaps in programs and services and policies. And one of the most profound feedback that we've heard is that we need to find a way to empower people to have autonomy on the types of programs and services they require to maintain their own quality of life. And sometimes that's healthcare intervention, and sometimes that's not. And this, our whole approach to social prescribing started when we wanted to enhance the integration between community, social, and primary healthcare.
Exactly.
And I personally was first introduced to social prescribing as a beneficiary of social prescribing. Some of you who have heard me speak will know I was raised by my maternal grandmother, who I was a primary caregiver of, who had vascular dementia. And while the primary health care providers did a phenomenal job in maintaining her physical well-being as best as they could, there was something missing. It wasn't until my grandma with advanced vascular dementia was able to walk amongst flowers and get a sense of color and the vibration of flowers, where she started to see smiles again, where we started to see her wanting to interact with people again. It wasn't until my grandma started to have a cup of chai or a cup of tea with people in her community that spoke the same language as her that we started to actually see her sense of purpose come back,
That's
her
right.
sense of self-esteem come back. So I was first introduced to this idea of social prescribing as a family caregiver of my grandmother.
That's
We
very
also,
interesting.
it's been so profound. Go ahead.
I just want to highlight as well where social prescribing first started. I know we had some discussions about this, and so maybe you can provide that information to our listeners.
Yeah, when we first heard of social prescribing, we actually took a trip to the United Kingdom, where they were championing a nationally driven approach to social prescribing through the National Institute of Health Services, and that the underpinning factor was that health was underpinned by a range of factors, including social, economic, and environmental factors, not just biological factors.
Mm-hmm.
And so, there are many parts of the world that are now adopted social prescribing, and we first learned of it from the United Kingdom. I will also say, Jane, I think social prescribing has been around in many different forms.
Yes.
We just don't call it social prescribing. We may call it person-centered approaches to care. We may call it community-level approaches to care. But the concept of valuing environment, social connection, the economic well-being is fundamental to this idea of social prescribing, and really allowing or enabling health professionals to be able to refer clients to these range of communities, programs, and services.
Yes. No, I agree. And, most definitely, I think the social workers within community organizations, that they have really been doing this type of thing because they are having a listening ear and having that communication with the client or the person in the community. And I think also connecting them to other resources within the community or social programs. I mean, in Toronto, we have a number of wonderful organizations and social workers working with such organizations as Circle of Care, Luma Care, Better Living, North York Senior Center. So many organizations doing wonderful things. And over COVID, really flagging those individuals that are needing that connection or running social programs online. So, yeah, there's a lot of great, definitely community work happening out there in all areas of the country. And what are some of the examples of social prescribing that you can sort of elaborate on, Kahir?
Yeah. So first of all, I think, your points are so astute, Jane. And, I would add that part of this work is removing barriers to access for people, and removing barriers of access to engaging with community. I'm going to quote one of our regional medical directors here in British Columbia. And she said, during a study of social prescribing, Dr. Grace Park, the regional medical director with Fraser Health, said that a study shows that even mild to moderate activity, such as gardening and walking and learning, such as music and art, can improve cognitive function in older peoples. And social prescribing can help older people engage in these activities by addressing barriers and setting achievable goals for older people. unquote. And I think it's important to know, while this quote was in reference to older people, we've learned in the way we do social prescribing in Canada that it's actually impactful for everyone. And a case in point is, very recently, doctors in BC and Ontario are now able to prescribe access to Canada's parks as
Yes.
a social prescription to people, really harnessing the connection between people and nature. And, this has been found to fundamentally improve both mental and physical well-being. We also have seen this in forest bathing in Japan, where connection to forest, connection to nature is so profound, especially given the noise and the modernities of the world that we live in, that being in the forest, being with trees, putting your feet to earth actually has proven to have fundamental impact on one's physical as well as mental health and well-being. We've also seen how simple things like a human voice, a
Yeah.
human touch, things like expressing oneself through art and music fundamentally changes one's DNA makeup or genetic makeup, so that it actually changes one's health outcomes.
Yes, those are very key points. And I think, when we're talking about person-centered care, and we've had many discussions, I guess that connection on the social prescribing and person-centered is, yes, we do need to find out about the person's interests and hobbies and likes and dislikes. And, providing those, I guess, activities, but it's not just about activities of doing this and doing that or painting or playing bingo. It's actually having meaningful conversations, doctors having meaningful conversations with their patients, social workers having meaningful conversations, PSWs, personal support workers, nurses, and understanding, the clients or residents that they're working with. And just, yes, that point, I guess, on the BC doctors, I guess that came out through the globalnews.ca from February the 1st article by Elizabeth McSheffrey, and you had reviewed that as well about the doctors in BC handing out park passes, which is amazing. And the forest bathing, yes, not a lot of people know about the forest bathing. Actually, that started in Japan in the 1950s. And the word that they use for that is, I don't know if I'm pronouncing it correctly, but it's Shinrin Yuku. And again, it definitely helps with the depression, anxiety, blood pressure, immune systems, and just 20 minutes of interaction with the outdoors is good for the soul.
Yeah. And recently they're looking at how to incorporate things like forest bathing into their actual healthcare system.
Yes.
As both a way to respond to emerging health needs, but also prevention, with a prevention lens as well. Sorry to interrupt.
Exactly. No. I just wanted to discuss about, I guess, the family doctors using social prescribing techniques in their practice, funding, how perhaps do other organizations implement social prescribing in their organizations for the benefits of their clients, training for doctors, new doctors on social prescribing, what does it mean and how would they do it? So maybe if you can elaborate on some of those questions. Thank you.
Oh, such interesting and important questions, and I think conversations to have. And, Jane, I'd go out to say that we still have work to do. We still have work to do to create awareness in our educational systems, in our policy systems, in our programs and services. But I also think we've done some incredible work here in Canada. Before I get into that, I just want to address a point that you made, which is so important, around meaningful conversations and meaningful dialogue. Mm-hmm. Look, all of us have a life history. All of us have a journey that we're on. All of us have certain skills. All of us have certain preferences, all of us have certain passions. And to be able to enjoy those passions, to be able to enjoy those preferences, regardless of your age or whatever walk of life you come from, is so important to one's holistic quality of life. These are conversations that don't often happen in a 15 to 20-minute medical room visit. These conversations require dedicated time and resources, which are so important, number one, for the quality of life of the person we're supporting. But also, if we really think about this long term, it has economic impacts on the healthcare systems if we're preventing people from using emergency room visits, from seeing their doctors. You know, in British Columbia, a recent study showed 1 in 4 older people in the Lower Mainland and 1 in 5 older people in Canada don't have one person to talk to.
Wow.
And, you know, being able to facilitate that conversation really is supportive of not only their well-being, but we also saw that those that had somebody to talk to were less likely to visit their family physician or call a crisis line or go into an emergency room for social connection. And so the idea of meaningful conversations is so important because you get to know the person for who they are.
Exactly.
And that helps to inform the choice of program or support that they would require. When it comes to some of the service delivery questions, look, social prescribing, as I said, can be interpreted in so many different ways. The fundamental concept being ensuring that there's social, environment, and economic connection and considerations to one's well-being. And so, you know, the first thing I would say is when we brought it to Canada, here in British Columbia, I'll speak of first, we found that just referring someone to an art program or just referring someone to a gardening program or just referring somebody for a walk in the park was not sufficient. Those people with compounding vulnerabilities who may be best placed to benefit from social prescribing needed some hand-holding, needed some support. So in British Columbia, we fund what we call community navigators that actually support the social prescribing recipient to access programs and services after their family physician or primary care provider has referred that as a need. And we've seen fantastic uptake from some of the doctors and divisions of family practices here in British Columbia. We see social prescribing emerging in other provinces in the country as well. In some places, you know, it's integrated in the community health center model, where anybody that enters the community health center could be prescribed things like a walk or gardening activity or art therapy or even pet therapy or eat-in therapy to be able to support their well-being. And, you know, it's very interesting to see the different models continuing to emerge here in Canada. And we're working very closely with different provincial partners to look at what is the impact this is having on people, on their lives, as well as on our systems, including where are our gaps. And, you know, creating awareness around this type of work to emerging physicians, to emerging primary care providers is so important. And I think there's an increased understanding, evidenced by the recent article that you referred to in the Global News. But I do think we have a ways to go in terms of informing policy as well as resource allocation for social prescribing. Yeah. The other thing I would say is, you know, the term prescribing sometimes denotes a top-down relationship. And so, you know, being very cognizant that this is about the individual and their autonomy to say, this is what I need to live a better life for me.
Yeah, it's very interesting. And I must say that in Toronto, we are starting to have care navigators through community organizations that are looking into these ways of having to connect to their clients, being discharged from the hospital, and they're needing that social connection, and how do they get that? And you're right, it's not just about, providing the information and then here you go. Sometimes people are needing more support. Within Mosaic, since we started 11 years ago now, we have done a form of social prescribing in the way that we do our social programs that we did prior to COVID face-to-face, and then now online. And within our care team, our integrated team, where we have our social worker and we have a person dedicated to person-centered care that would work with the PSWs and the family. So again, finding out about the person, what are their interests, what are their hobbies, what are their goals, what are things that Mosaic can provide to help them connect back out into the community? Is there programs that they can go together? Is there a coffee shop that maybe the personal support worker or the whoever the family hires to go with that individual? But there's lots of things happening within the cities now. I think in the spring and summer, we'll certainly see more things in parks, more markets, and more places for people to connect. So things are moving slowly. I just want to ask about, I guess, social prescribing. We've talked a lot about perhaps the urban, but what about in the rural areas? How would you implement social prescribing or working with community agencies on that level?
Yeah, it's an interesting concept, and I'll expand that question if you allow me to saying, how do we offer social prescribing to traditionally underserved and underrepresented communities? So we know rural Canada in many places is underserved. We know that First Nations communities across Canada are underrepresented. We know, newcomers sometimes, those that identify as LGBTQ2SI, also have different nuances and different factors. And it's really important to ensure that, the work that we do is customizable to the person that we're serving and to the geographical community that we're serving. And I think the beauty of this type of work is that it is moldable to where one lives and how one expresses themselves. And, this can look and feel like different different things. I'm going to share a story about Roger, who lives in a rural community, not in British Columbia, but with somebody I had the distinct honor of talking to. Roger has been in the health system for decades. He suffered trauma as a child. He's had, some people call it mental health issues. I like to say he's been emotionally fragile for the majority of his life. And for decades, doctors were prescribing him different types of medications to take. And he lives in a community of 1,200 people. So a very rural, remote community. And he's a person of ethnic descent in a community that doesn't have a lot of ethnic diversity. Roger started to find ways to cope with his issues on his own because what was getting prescribed to him traditionally just was not working. Last year, he was referred to a social prescribing program in a neighboring rural community. So sometimes rural communities can partner
Yes.
to offer a program. When Roger was assigned a case navigator, from Roger's perspective, he said this was the first time that someone actually listened to me. I was able to tell my story and be seen as a whole person, not just for the symptoms that I was exhibiting, but for my historical life experiences. When Roger first started talking to the navigator, he was extremely emotionally fragile. He was coping in ways that, many of us would see are unhealthy ways of coping. After working with a case navigator, Roger now has a routine that includes daily exercise, He's joined the local recreation center in this small community. He started playing pickleball,
Wow.
which is important in this particular rural community. And he attends aquasize classes twice a week, even though he's the youngest and the only male in that class. And his psychologists and counselors and doctors have said that they've been amazed with his progress that has not been achieved over decades of support. And I
And
think that,
working, yeah, and working, with a medical profession that are perhaps prescribing the medication, not really taking the time to listen to him. And that's where the meaningful conversations come in. Yeah.
that's right.
What an amazing story. So it sounds he's doing well and all, and it's simple, really, isn't it? I know you do have to have the funding and the care navigators, but just simple listening to somebody and sort of hand holding them until they feel that they're confident enough to do it themselves and partake in the community, and not feeling nervous going into programs as well, because that takes time for somebody who hasn't been used to that as well. But
I
thank
would
you for
say
sharing.
it's also empowering, I would suggest.
Yes.
It's empowering for that individual to say, you know what? I don't need to rely on somebody to create music, to create
Yeah.
art, to go for a walk. This is something that I'm empowered to do, and we found that to be very profound in the lives of people as well.
Yeah. Thank you for sharing that. Definitely an amazing story. Um, so I just wanted to find out a little bit of this. If you can discuss the work of Core Canada and the Social Prescribing Network, and how would organizations get involved in this group to create a movement? And then how will this evolve nationally, or how do you see it evolving?
Yeah, look, social prescribing, I think, is being picked up in multiple provinces. And as a result, we have formed partnerships across Canada around understanding how does social prescribing work in your province, who's involved, looking at some of the different models in existence. So there's been a few things that have happened. First of all, we have brought together social prescribing service providers from across the country in what we call a community of practice, or a way to learn and share, and share best practices or promising practices with one another. And that allows us for quality improvement, quality assurance, and being creative in how we're embracing social prescribing across the country. And, there's always power in collective thought, in collective wisdom, in collective voice.
Yes.
We've also know that the people that know this program the best are the organizations and people that are delivering it. And as a result, we've created online platforms and networks for people to come together, to discuss, to share examples, to share stories, to suggest ideas, as well as to inform potential policy around what the future of social prescribing in Canada will and could look like. We're also looking at ways to build infrastructure around what social prescribing in Canada looks like in different provinces, in different territories. We have a vast and beautiful geographical landscape in this country, which poses its definite benefits, but there are geographical challenges as well around access to resources that we are also looking at supporting and resolving. For those that are interested, feel free to reach out to any one of us, Jane,
Mm-hmm.
yourself, or myself. As well, we will, if you do reach out to us, we will connect you to the core site for some more information. We're also looking at doing a white paper on what social prescribing in Canada looks like. And, I will say social prescribing is not exclusive to the nonprofit charitable sector. There's so many organizations that are doing this in their day-to-day work. And they may not always see it as social prescribing, but the work and the impact that these organizations are making are similar to the outcomes and impact that social prescribing in its formal concept is also making. And so really trying to bridge, I would say, formal social prescribing and informal social prescribing to demonstrate the impact of socio-cultural, socio-environmental, socio-economical factors on one's quality of life.
Wow. That's a lot of work to move forward. But those Core Canada Social Prescribing Network, Mosaic, I guess, attended the first one online, and that was amazing, like listening from people from around Canada and, some of the gaps that they see, some of the ideas that they're bringing to the table and sharing, and then hopefully, moving it within, areas of Canada as well. How would somebody get a hold of you, or what website should people be going on to connect with you or social prescribing movement, Kahir?
Yeah, so you can reach out to me at my email address, which is kahirl@uwbc.ca, and we can link it into the podcast here. You could visit uwbc.ca. And if you do reach out, we will connect you to a core site, which will require a sign up, a free sign up to get into. But there's also a lot of papers and learnings that one could frequent. So part of the work that we're doing is continuously learning from other parts of the world. So, we recently had a national webinar with folks from the Compassionate Project in the United Kingdom to come and talk to us about, significant developments in Frome and what social prescribing looks like there. And so it's really an opportunity to enhance our learning, our awareness, our understanding, and access to these webinars are also on the website.
Yeah, that's amazing. I think, and thanks for sharing your contact information. I think, one thing that I found with COVID is it's brought countries closer together, and professionals and social workers and community agencies and private agencies. And, definitely the IFA is a prime example of connecting on the Global Cafe and finding out what different programs there are, what different models and processes are available, and ideas, and sharing them. We also have Kahir's article on social prescribing, which can be found on Mosaic's winter newsletter on page 10 and 11, and you can certainly download that by going to www.mosaichomecare.com. And Kahir, do you have any final takeaway messages or final thoughts that you want to share with our listeners today?
Yeah, I think the final thing I say, Jane, is, all of us stand to benefit from this. I can't tell you how much better I feel when I go for a walk in the park, or, water, for example, is something that really energizes me. A meditation is something that energizes me. So all of us stand to benefit from the impacts of, whether you call it social prescribing, whether you call it art, music, nature, forest bathing, park attendance, whatever you call it, we all stand to benefit from it. And in a world where we're so caught up in time and time management and work and family obligations, it becomes even more important, I would say, for us. And I'm a number one culprit around this, but it becomes even more important for us to be able to do this for ourselves as well.
Yes, most definitely. And thank you for sharing that. And I think, it's the connections that we make to people. And I think that's also important. And again, that meaningful conversation that I always like to come back to, from taking small talk to meaningful conversation, and for professionals to implement that in their practice. I would like to thank you, Kahir, for an insightful discussion on social prescribing, and for our listeners who are interested in this topic, and to the production crew for putting this together for Mosaic. So stay tuned for our upcoming podcast featuring Epilepsy Ontario. Until then, maybe try a bit of forest bathing for you and your soul by experiencing nature and all that it has to offer, or connecting to your community. thank you again for listening to our podcast.